most adults, it takes them several days at least to get into ketosis, even if they're not eating anything at all. So fasting can take 2 to 3 days at a minimum for most people to get into ketosis, but some people it can take a whole week.
And you talked about children there. One of the big conversations at the moment around children is the rise in ADHD diagnosis. And there's a lot of different sort of thoughts on the causal factors of this and what is it that's making children be diagnosed at higher and higher rates with these sort of neurodivergent disorders. Is there any evidence to suggest that what we're eating is playing a role in these neurodivergent disorders?
Yes. The first thing I would like to tell you about is that there were studies, quite a few studies back in the 80s, 90s, and early 2000s in Europe by a variety of different research teams that explored exactly the question you're asking. And what they did was they placed children with ADHD, some quite severe ADHD, even hospital level ADHD, and put them on something called a few foods diet. This is, the scientists call it an oligoantigenic diet, which just means it's kind of a low allergen diet. So they removed all of the common culprits and they focus mostly on just a few whole foods and a few extras. So very specifically describing this diet, most of these diets were chicken, lamb, fruits, vegetables, and sometimes they'd throw in some apple juice and margarine because they couldn't use butter because dairy is a common allergen. So, but these were mostly whole foods diets, poultry, red meat, fruits, vegetables. And there were 62 to 82% response rate to these diets, no matter which study you looked at. In some of these studies, there was a 70% cure rate within weeks of changing the diet to a few foods diet. So what does this tell us? It doesn't tell us which foods were the problem. It tells us that food can be the problem. That if you make the right dietary changes, it's possible